Welcome to the launch of the 2021 MJA-Lancet Countdown on Health and Climate Change. I'm Tony Capon, the Director of the Monash Sustainable Development Institute. And as we begin this launch webinar, I'd like to acknowledge the traditional owners of the lands we're assembling on all around Australia, and for those that may be watching in other parts of the world. I'm today on Wurundjeri country, people of the Kulin Nation here in Melbourne, and I acknowledge elders past, present and emerging. Today's webinar is being recorded and it will be available later on Monash University's YouTube channel. During the webinar, you're welcome to submit questions for our speakers and panelists via the Q&A function at any time. And if you do see a question in the Q&A list that you particularly would like an answer to, then feel free to upvote that. This will help prioritize it for attention. The Lancet Countdown was established 5 years ago. It's an annual reporting process to track progress on health and climate change globally. In 2018, here in Australia, we were the first country to produce a downscaled national report, a partnership between the Lancet and the Medical Journal of Australia. The co-chairs of the Australian process are Paul Beggs from Macquarie University and Yin Zhao from Sydney University. And Paul and Ying work with a group of colleagues from across the country. Today's launch webinar is co-hosted by the Monash Sustainable Development Institute, which I direct, and that Melbourne Climate Futures, where our colleague Catherine Bowen has a lead role. The webinar will be in three parts. Firstly, we'll hear from three speakers who will talk about the findings of the report. Then we'll hear from three panelists who will elaborate on the key messages, bringing their own perspective to the report, including in the context of the upcoming Climate Change Conference of the Parties in Glasgow. This will be followed by the open Q&A segment. Before I hand over to our first speaker, I'd just like to share an image with you. This image is from the 2019-2020 bushfires. Alison Marion took this photo of her son, Finn Burns, as he was piloting a tinny to help his family escape from the bushfires in Malakuta in far eastern Victoria. It's an arresting image and a stark reminder of those devastating fires. Because the coronavirus pandemic has been the focus of Australian public policy and debate since early last year, as a country and as communities, we're yet to fully process the enormity of the 2019-2020 bushfire season. Those fires demonstrated that our climate has changed. They showed that climate change is already affecting our health. There is much to be done. We must act more urgently. Let's now go to our first speaker, Associate Professor Celia McMichael, who's a health geographer at Melbourne University. Celia is the only Australian-based author of this year's global report, and she'll tell us about that report and some of its key findings. Over to you, Celia.
Thanks, Tony. I will share my images once you unshare yours.
Oh, sorry. Sorry about that.
No, that's fine. Okay. So yeah, I'm going to briefly highlight some of the key messages from the Global Lancet Countdown report that was also released today. Every year since 2015, the Lancet has published an annual report which tracks the threats to human health from climate change, and as well the health opportunities of climate adaptation and mitigation. So this year's Lancet report is rather soberingly entitled Code Red for a Healthy Future. It presents 44 indicators across 5 domains, which include the health impacts of climate change, opportunities for adaptation, the health co-benefits of mitigation, as well as the broader economic context and political engagement. It finds that the health impacts of climate change are indeed worsening, affecting people across the world, and documents escalating exposure to heat waves, to climate-sensitive diseases such as dengue and cholera, increasing population to exposure to wildfires or bushfires, like the image we've just seen from Tony, and drought, and accelerating threats to food security. It also underscores the many ways that climate change is acting to increase health inequities, because climate change often amplifies or exacerbates the hazards that people face, particularly those who are already living in vulnerable contexts with food and water insecurity and exposure to drought and heat waves. So the imperative is really clear. We need accelerated action, putting the health of people and planet first. To give just a couple of examples from the many indicators, this year's report finds that in 2019, heat-related deaths for people older than 65 years of age reached a record high of almost 345,000 deaths. And to put that in context, that's 80% higher than the 2000 to 2005 average. In 2020, up to 19% of the global land surface was affected by extreme drought. And if you look at this figure, you can see that this is a clearly increasing trend. And obviously drought threatens foundations for good health through things like water security, sanitation, food productivity. The indicator that I work on looks at exposure to sea level rise. There are currently 150 million people living in coastal areas that are less than 1 metre above current sea levels, and about 570 million settled in areas that are very low coastal zones, so less than 5 metres above current sea levels. Without adaptation, they face increased risks of flooding, more intense storms, soil and water salinification. And while a lot of people will adapt in place, some will relocate away from sites of coastal risk. Importantly, the 2021 report also highlights that climate change mitigation actions are good for our health. So things like urban greening, clean electricity, healthy active transport, reduced meat consumption, these are all ways to reduce greenhouse gas emissions, as well as improving the health and well-being of populations. But there are really deep inequities in the global contributions to greenhouse gas emissions, as we well know, for those of us in Australia, as well as the ways that countries respond and experience the impacts of climate change. We need very rapid decarbonisation in order to deliver better health for all. Obviously, this year's report coincides with COP26 in Glasgow, where countries are facing pressure to realise the ambition of the Paris agreements if we're going to keep global heating below 1.5 degrees. And we're all hoping and demanding that Australia doesn't show up empty-handed, but commits to net zero. We need to act together to ensure that no person is left behind and ensure healthier futures for all. And essentially, that's the key message of this year's report.
Great. Thanks very much, Celia. That's a terrific overview. And you should see in the chat box a link to the report if you'd like to follow that afterwards.
Thanks, Tony.
Terrific. Now to our second speaker, Associate Professor Paul Beggs, who's an environmental health scientist from Macquarie University. Paul's the lead author of the MJA-Lancet Report, and he's going to tell us about some of the key findings of the Australian report this year. Over to you, Paul.
Great, thank you, Tony. I will just share my screen. So, hello everyone, it's great to be with you this afternoon. I wanted to start by simply saying that I'm presenting this afternoon on behalf of a very large team, the MJA Atlantic Countdown team. So this is very much a joint work. So the MJA-Lancet Countdown, as Tony said, tracks progress on health and climate change in Australia in particular. It was formed in the year 2017 and is a partnership with the Medical Journal of Australia, the MJA, and the Lancet Countdown. It's an interdisciplinary research collaboration, and as Tony said, it's produced reports that have been published in the Medical Journal of Australia in 2018, 2019, 2020, and the report that we launched today in 2021. And our intention is to continue reporting annually through to the year 2030. As Celia has just very nicely introduced, we look at the same 5 broad areas as the global report, and we examine about 40 indicators within those 5 broad domains. And you can see those illustrated on the right-hand side image. Central to our work, of course, is looking at the health impacts of climate change. We also look at the responses to those impacts, health adaptation and health benefits of mitigation. And also, equally importantly, we look at the context in terms of the economics and politics within Australia. So the 2021 report of the MJA-Lancet Countdown presents exactly 37 indicators across the 5 domains. And very exciting this year, 7 of those indicators are brand new, and 3 of those 7 are unique to the Australian report that have been totally developed here in Australia. The report is available from the MJA website, but also from this DOI link. And you can see the cover of the report over on the right-hand side there. The report this year is produced by 19 experts from 8 universities, 7 of those in Australia. So my own institution, Macquarie University, the University of Sydney, the University of New South Wales, 2 universities in Victoria, Monash University, of course, and the University of Melbourne, the Queensland University of Technology, and the University of Tasmania. And we work very closely with colleagues in the UK at the University College London, where the Lancet Countdown is based. And we also, very importantly, acknowledge a large number of other contributors to the report, including several colleagues at the Australian Bureau of Meteorology, including Dr. Elizabeth Ebert. So I wanted to spend the remainder of my time just quickly going through the indicators for each of the 5 broad areas and to highlight the new and Australian unique indicators and show you some quick results. So this is the set of indicators for climate change impacts, exposures and vulnerability. And very importantly this year, one of our new indicators is the Indigenous Health and Climate Change indicator. And Ollie J will be presenting on the other new indicator in this area, health impacts on physical and sporting activities. In terms of adaptation, planning and resilience for health, we have 7 indicators as listed here. And again, 2 of those are brand new this year, including one looking at bushfire adaptation, which is unique to Australia. And this tracks both the terrestrial and the ground-based firefighting capacity here in Australia. So you can see the blue line showing an increase in airborne firefighting capacity in Australia over the past 10 or so years. But over the past few years for which data is available, a decrease in the firefighters on the ground. In terms of mitigation actions and health co benefits, again, we have a large set of 10 indicators. including the one highlighted here, looking at sustainable and healthy transport. And Australia is very much still heavily based on fossil fuels for its transport, things like diesel and petrol, although there is growth in electric vehicles, and we hope to see that grow further in coming years. In terms of economics and finance, we have a set of 6 indicators, and it's very exciting to see employment in renewable energy activities increasing over the past few years. And again, we hope to see that escalate over the coming few years as we move towards renewable energy. And finally, in terms of public and political engagement, we have a set of 4 indicators. And the bottom one there, looking at health and climate change funding in Australia, is again new and unique to Australia this year. So to conclude, Australians are increasingly exposed to and vulnerable to climate extremes. The continued absence of a national health and climate change plan is a glaring gap which continues to put the health and lives of Australians at risk. And finally, COP26 should be the moment for Australia to showcase a much stronger emissions reduction commitment and a clear transition away from fossil fuels towards renewable energy. The strategies for which could support the COVID-19 economic recovery through government support of the renewable energy sector. Thank you very much. And back over to you, Tony.
Thanks very much, Paul, for outlining that. And again, we'll make sure that the link to the MJA report is shared with you through this webinar. Now to our final speaker, Professor Ollie J, who's a thermal physiologist at the University of Sydney. And Ollie's going to give us a perspective on heat and health from this year's reports.
Great, thank you so much, Tony. So I'll just start off by just outlining the problem that is facing all Australians with respect to heat exposure. It's really very well documented over the past decade that pretty much irrespective of where Australians live, they've been exposed to unprecedented temperatures. These mean annual temperature anomalies relative to recent history do not necessarily present a massive health risk from the perspective of heat stress. The heat health risks really arise from the associated increase in intensity, duration of heat extremes, otherwise known as heat waves. We also know that with future warming, all 3 of these heat wave characteristics are going to increase really quite dramatically, irrespective of the climatic region within which we reside. The extent of this escalation will depend, of course, on the magnitude of future climate change. So why is this a problem? It's mainly 3 reasons. First of all, we know that extreme heat events are responsible for more deaths than all other natural disasters combined. This is especially evident among those who are more physiologically vulnerable to heat strain, such as people with cardiovascular disease, people who are susceptible to classic heat stroke, or people with renal disease. Heat exposure is also well known to be responsible for at least $6 billion, that's with a B, of lost labour productivity in Australia every year. Extreme heat also poses a significant health risk of exertional heat stroke, which is slightly different to classic heat stroke, in people that are participating in summer sport or recreational physical activities. This is particularly important for Australians, given that more than 70% of Australians participate in sport or physical activity on a regular basis every week. And indeed, sport and physical activity really forms the cornerstone of Australian life in many respects. So to this end, there are 4 heat-related indicators in this year's countdown report that cover these particular challenges. But the one thing I just want to take a couple of minutes to highlight is the new indicator that Paul referred to just in his talk just now, which is indicator 1.4, that assesses heat impacts on physical activity and sporting activities. So this is a new indicator that utilizes the latest research from our team at the University of Sydney, alongside our good colleague, Dr. Carolyn Broderick, who's the Chief Medical Officer of Tennis Australia, and also Dr. James Smallcombe, who works as a postdoctoral fellow in my research program. And what we did together alongside Sports Medicine Australia is that we developed a new heat stress risk assessment tool. And this now forms the cornerstone of the new extreme heat policy that Sports Medicine Australia will apply across all physical activities and sports in the summer, starting this year. What this tool does is that it uses local concurrent temperature and humidity inputs that we acquire from meteorological measurements nearby. And then this tool stratifies the heat stress risk to the individual based on the risk of exertional heat stroke into 3 elevated categories above the green area that you see here. So if you reach the yellow area, it's a moderate heat stress risk. If we reach the orange, it's a high heat stress risk. And then if it's red, the heat stress risk is considered extreme. And then these stratifications are accompanied by escalating measures to reduce the risk of exertional heat stroke. And ultimately, this will culminate in the suspension of play if we reach the extreme heat stress risk category. So this first figure that's shown in this year's report details the number of days that each risk threshold was crossed each year since 2001 using historical weather data from 8 major cities across Australia, which are detailed in the caption at the top of this screen. What is clear is that since 2015, the warmer summers that we've experienced have resulted in much more extreme conditions, and this in turn has led to a greater number of days in which some disruption to sporting activities or physical activity would have occurred. Indeed, relative to the 5-year average, which we look at from 2001 to 2005 inclusive, the number of days in which play or sporting activities would have been suspended more than doubled in 2019 relative to this baseline period. This next figure stratifies these data based on city. And what we can see here is that of the 8 cities that we analyzed, 6 had a greater number of days with activity suspended due to extreme heat in 2019 relative to the 2001 to 2005 average. And what we saw was a 3 to 5-fold increase observed in the number of days that where play or physical activity would have been suspended in areas such as Alice Springs and even in Sydney here in New South Wales, where I'm speaking to you from today. So for a deeper dive into the health challenges associated with extreme heat and hot weather, as well as a detailed focus on potential solutions, I'd just like to direct you to our series of papers on heat and health that we published together in the Lancet in August this year. I'll pop a link in the chat function when I've completed this talk. So thank you very much for your time. Happy to take any questions at the end of this session. And back to you, Tony.
Yeah, thanks very much, Ollie. That's a great deeper dive into heat and health in the context of the report. So there's a lot in these reports, so I encourage you all to look at them in more detail after the webinar. So now let's move into the second part of the webinar today, the panel discussion section. And I'm delighted firstly to welcome Professor Lisa Jackson-Pulver, who's Deputy Vice-Chancellor, Indigenous Strategy and Services at the University of Sydney. Lisa's an epidemiologist with expertise in Aboriginal health. So Lisa, how's climate change affecting Aboriginal and Torres Strait Islander people, and in particular their health?
Yeah, absolutely. First and foremost, I'll pay respects to traditional owners of the country that we're coming from and what the lands that you're on. So thank you for the question. How does it affect Indigenous people? How can it not affect Indigenous people? When you think about it, the millions and millions and millions of Indigenous peoples from all around the world are becoming more urbanised, and at stressful times like this, which has been a continuing thing, as we've seen on some very nicely established work over the last 20, 30 years, but certainly for our lot here, well over 200 years, continuing inequities that just become wider and wider and wider when the stressors are on. We're seeing more mass extinctions of critters on traditional lands. Yet people remain resilient. People remain strong in culture. They remain strong in ceremony, dance, and continuity of culture. More on just how we need to get past this and not continue to pass this important task on to the next generations. As many will know, Aboriginal and Torres Strait Islander people have never ceded lands, have never sold lands, and still are continuing to recognise our own sovereignty upon this place. And that work is being passed on to generation after generation. And there are just some things that can't wait. That's one of them. But what we're talking about today, climate change, and the expectations that somehow the next generation will fix it up, as the last generation expected us to do, can no longer be continued to be passed on. Auntie Matilda House in 2008 did a welcome to country in the Parliament before the historic day of the apology to stolen generations, and many of you would remember that. And in that talk, she spoke of rights, responsibilities and obligations. And she told us a lot about what is a welcome to country, what is an acknowledgement of country, and how all of us in our institutions, in our organisations, in our reports, upon government doors, you see an acknowledgement of country. On the ABC, the news is coming from country. And that's one part of what we have to do as an obligation. But how is it we as Australians are endeavouring to belong to a place that's been cared for and nurtured for 60,000 plus years? And this is a question I ask all people across the world whose genetic inheritance does not come from that land. How are they submitting to the obligations of caring for country? How are they submitting to the rights for future generations to continue on? And I have to say, if we had a report card right now, it would be pretty low. If we look in COVID, as an example, and this is a time that will pass, the COVID time will pass. But a lot of people are saying, I have a right to be free, I have a right not to have a vaccination, but there's obligations to community and to others to get these jabs. I don't really care where you all stand on it, but for me, really we have to protect others in community. But how are we as a scientific community recognising those obligations and owning the responsibilities that we have to maintain our own resilience so we can be brave and be courageous, so that the next 60,000 years of caring for country won't be something which is a transient thought as we manage to kill ourselves out over the next few decades. No, we have to do something, and we have to do something now. Thank you very much.
Look, thanks very much, Lisa. I think a really powerful plea for Indigenous ways of knowing, being and doing, bringing Indigenous perspectives right to the centre of the way we understand health and climate change. So next, I'd like to welcome Yin Zhao, who, as I said earlier, co-chairs the MJA-Lancet Countdown process with Paul Beggs. We had anticipated that Georgia Behrens, a young doctor at a busy hospital in Sydney, would be speaking with us today, but she was called away at the last minute. So thanks to Ying for jumping into the breach here. And Ying, tell us a bit about the main recommendations in this year's policy brief.
Thanks, Tony. And alongside the full countdown report, the team also develops policy briefs for Australian policymakers. And in this year's policy brief, we focused on 3 themes, including how heat impacts our lives, as Ollie mentioned earlier, climate change and the health and the well-being of Aboriginal and Torres Strait Island peoples. That has been mentioned several times already in the webinar. And the third one on sustainability in Australia's healthcare sector, given that healthcare contributes to about 6% of Australia's annual carbon emission. So we call for policy changes to address these issues. Specifically, we propose to develop a national heat and health strategy to coordinate heat responses and preparedness and responses, to provide funding and support to make sure that Aboriginal and Torres Strait Island peoples are at the center of climate and health decision-making and implementations, and to establish ambitious targets of net zero emission healthcare for Australia. And in previous policy briefs, we've also strongly argued for a national strategy on health, well-being, and climate change, which does require authentic leadership in the federal government.
Great, thanks very much, Ying. And we'll put the link to the policy brief, share that with you as well during the webinar. Ying, tell us about how the policy brief is developed and some of the partners that we work with on the brief.
Yes, the policy brief was developed based on not only the scientific findings from the Australian countdown and the global countdown reports, but also in consultations with individual experts and stakeholders on health and climate change in the country. Specifically, we would like to thank the contribution from colleagues at the Climate and Health Alliance, the Australian College of Nursing, the Australian Indigenous Doctors Association, the Australian Medical Association, the Public Health Association of Australia, and the Royal Australasian College of Physicians. We would expect the list of former partners will be expanding along the way, and we are welcome to new partners who are keen to working on health and climate change. As you would agree that health communities are increasingly involved in policy advocacy for more climate actions, and together we are sending stronger messages to policy leaders, and we can drive changes required to protect Australians' health from climate change. So please help us promote the important work. Thank you.
Thanks very much, Ying, and congratulations once again to you and to Paul for leading this process. And it's terrific to see the way our partners across the health sector here in Australia are getting behind the MJA-Lancet Countdown process. So our final panelist today is Harriet Scandal, Senior Policy Advisor, Climate and Political, with the British High Commissioner here in Canberra. Harriet, welcome to the webinar. The Glasgow COP is now only about 10 days away. How's it all going?
Yeah, thanks so much for having me, Tony. And I'd just also quickly like to acknowledge that I'm joining this webinar from the traditional lands of the Ngunnawal people down in Canberra. And I'd like to pay my respects to elders past, present and emerging. Yeah, so as you said, COP26, it's just 10 days away now. And even though, you know, COVID has been a huge challenge for the organisers, we are still expecting it to be the biggest COP ever. So, you know, over 30,000 people, I think, expected to arrive in Glasgow in the next few weeks. As COP26 president, we're focused on delivering a fair and inclusive COP that's really focused on the 3 pillars of the Paris Agreement. So mitigation through raising emissions reduction targets, through adaptation, and through ensuring that there's enough international climate finance as well for everybody to deliver on their climate ambitions. But in addition to the negotiations, we're also trying to make COP a platform for collaboration on the key solutions that are going to help us to tackle climate change and actually keep those Paris goals within reach. So we have been putting together a pretty enormous program over 2 weeks in Glasgow, where there'll be themed days across the 2 weeks where we celebrate the different solutions that are going to help us to adapt to and mitigate climate change. So looking at things like energy systems, zero emissions transport, nature-based solutions, green finance, and then also things like looking at the role of you know, gender-informed climate action, the role of young people in civil society, and of course, the impact of science and innovation on tackling climate change.
Great, thanks. Thanks for outlining that for us, Harriet. Let's come more specifically now to health and climate. Where does health fit in to the COP process this year?
Yeah, sure. So, I mean, as we've heard from everybody already today, we know that building resilient and low carbon health systems is going to be really critical, not only for mitigating climate change, but then also for ensuring that we're adapting to the impacts of climate change that we've already, you know, felt, as that picture of the child in the boat showed already. So at COP26, we've got the health, we've got a COP26 health program that's going to be celebrated on Science and Innovation Day at COP on the 9th of November. And so the COP26 health program is being run around the world in partnership with the World Health Organization and other organizations like Healthcare Without Harm and those kind of bodies. It's got 4 pillars. So the first is building climate resilient health systems. The second is building sustainable low carbon health systems. The third is adaptation research in health. And then the fourth is empowering health professionals, so doctors, nurses, and so on, to be advocates for climate action as well. So the kind of the key pillar of the COP26 Health Day will be that we're inviting governments all over the world, so both national governments and subnational governments, to make commitments to transition towards resilient and low carbon health systems. So that might include committing to actions such as, you know, conducting a climate and health vulnerability assessment of the population. It might look at developing a national health adaptation plan, setting a net zero target for your health systems, or, you know, a broader climate action plan to show how you're going to transition towards that low carbon health system. So we've already been, you know, throughout our network, the diplomatic network, been having pretty robust discussions with about 50 different countries, and we've already secured over 20 commitments that'll be announced at COP, which is really exciting. In the UK, we are trying to lead by example as COP president as well, to help with our credibility. So the NHS, the National Health Service, already has a target of reaching net zero emissions for its scope 1 and scope 2 emissions, I think it is, by 2040, with a hope to actually reduce it by 80% by the end of this decade, which is pretty exciting.
Yeah, thanks very much, Harriet. Absolutely, your mention of the greener NHS initiative there at the end, I think, is really important. The UK is not just telling other countries what to do. They are genuinely trying to get on with the job of establishing the world's first net zero health system. And for those with us today, just to mention that that work is being, in fact, led by a young Australian doctor, Nick Watts, who was recently appointed as the Chief Sustainability Officer for the National Health Service in the UK. And in fact, Nick established this whole Lancet Countdown process about 5 years ago. So he's a bit of a dynamo, young Nick Watts. So thanks very much, Harriet. We might come back to some of the COP issues in the Q&A. Let's invite everybody back on now for discussion. You're welcome to turn your mics back on and your cameras. Maybe keep your mics off until you're speaking if you've got background noise, of course. But let me just open the Q&A box here as I try and juggle the technology. I've got some questions here. Let's start with this first one from Jennifer Dam. The Victorian government, oh, no, she's dropped down. I'll just have to keep track of this. The Victorian government recently mandated that local governments must take action to address the impacts of climate change on health in public health and wellbeing planning. How critical do you think the role of local governments is, and what type of actions should they be taking? I wonder if any of our speakers or panelists would like to jump in on this one, perhaps popping your hand up if you'd like to lead off. I can see Lisa Jackson Pulver there. Jump in, Lisa, please.
Yeah, just an initial comment, and then I'll hand over to the others who will definitely have some fabulous things to say. But one of the things, there's a difference between looking at the effects of, but there's also that preventative mechanism. So I think there's two things that we need to do, is that we need to stop doing the bad stuff and we need to heal what has been done. And one of the things for local councils that I've witnessed, at least here in New South Wales, has been their absolute desire to work with Aboriginal holders of knowledge about practices ranging from freshwater, fire, things like being able to sustain biodiversity locally. So there's a lot that council can do about preventing more, and I'll just let some of the experts talk about what to do with the damage that's been done.
Yeah, I wonder, Ollie, and unless I can't see any other hands up, but I know that in Western Sydney, the Western Sydney Regional Organisation of Councils, the Penrith City Council, they're very concerned about heat in this context. And clearly they have potentially a key role to play in reducing the urban heat island and the health impacts of extreme heat.
Yeah, absolutely, Tony. So there's clearly a lot of interest in addressing these issues. people are definitely taking it seriously, and I think that's important. Probably the key is focusing on solutions as opposed to just further describing the problem in some cases. And also, I think is getting organized. One thing that we've run into on many occasions is that there are multiple entities striving to develop solutions or addressing these problems. And there seems to be a clear lack of communication. So there's kind of duplications of effort. And I think finding some kind of way to ensure that people are working together is really a big challenge for us moving forward. So that's kind of really my main comment on that.
Yeah, no, thanks very much, Ollie. And I can see Celia's hand up and also Harriet. So Celia first. Yeah.
I mean, it's a good scale at which to look in Australia. A lot of the really positive examples of action are happening at the local government area, you know, with, say, health centres putting in renewable energy powered systems, or urban greening, or really strong community engagement. But of course, what we want to see at COP is very strong commitment from the federal government. And that they should take note that there's demand happening at that lower community level. And, you know, even in some of the more mainstream papers, we're seeing that now. I think it's the first time in maybe 20 years that there's been a sense of a glimmer of hope that perhaps we're turning the corner and there's strong momentum. So what, you know, in local government, there's a lot of activity, and in some state governments as well. But of course, we want net zeros, and not with a detour through gas-led recovery, but renewable energy and net zero emissions urgently.
Thanks very much, Celia. And Harriet, did I see your hand up as well? Yeah.
Sorry, I went with my real hand rather than my virtual hand.
Conventional.
Yeah, my analog hand, exactly. Yeah, I just wanted to say, you know, as part of our COP presidency, we're trying to focus on this whole of economy approach, which basically means, you know, not just going to national governments, but also going to subnational governments and, you know, cities and businesses and communities and so on. And so we really would support the role of, you know, local health districts or local governments in being able to tackle climate change in a way that's really appropriate for their communities. And just like to point out, there's a massive international campaign called the Race to Zero, which is run by the UN, and one of the Race to Zero partners is specifically designed for healthcare systems. And one example of an Australian member is the Hunter in New England local health district. They've already joined this massive initiative, and they've committed to net zero emissions by 2050 and credible interim targets as well. So I think a lot can be done on a local level that has a really significant impact, you know, on the community and also you know, nearby communities too.
Yeah, no, thanks very much, Harriet. I think that example from Hunter, New England is a really good one in terms of that district level health service response. And in that case, led from the local board level with strong support from the executive and staff across the health system. So definitely worth people looking at that example too. Perhaps a final remark from me about the local context. Of course, when we think back to the first Earth Summit in Rio, way back in the 1980s, it was the so-called Agenda 21 that came through there strongly, the importance of local government, thinking globally about these big issues like climate change, but acting locally. You know, we absolutely need the engagement, and I think great examples highlighted by our speakers just now. Now, I can see there's lots of really interesting questions here. We've got 15 minutes or so, but I might pick up on this one about drought. Celia, you mentioned drought, 19% of the land surface in extreme drought. Ingrid Johnson says we may need to add drought to the list of climate and weather phenomenon that climate change is defining. How long would that list be now? You know, there are a range of different weather extremes, aren't there, that are relevant here, and many of them relevant to displacement and migration, which I know is an area of your expertise. But would you like to just open up a bit more about that?
Yeah, I mean, drought is a really foundational issue for human health, and not just through the direct thing that you would think of, such as, say, water security, but obviously through food supply and impacts on food security. And in the space I work in, there is a lot of efforts to try and understand the impacts on human mobility. Do droughts in the Horn of Africa lead to large-scale displacement? And can you attribute that as being climate change forced movement? In part, for sure you can, although of course decisions to move are really complex and linked to economics and livelihood, but climate change is amplifying these risks. And even where people don't move in a context of drought, then you have this kind of trapped population that are exposed to climate risks, which is equally a problem. I mean, the so-called climate refugee is a very visible example of people that are vulnerable to climate change, but people who are trapped in places with escalating risks are going to face some of the more severe consequences to health as well.
Great, thanks very much, Celia. Now I'm just trying to keep an eye on very lots of things going on here in the chat box and everywhere. I'm getting a little bit technologically challenged, but I was interested, Lisa, I see a question there about traditional knowledge in this context. It just seems to have disappeared from my screen, but I just wonder, traditional knowledge is really important, isn't it? We often don't value traditional knowledge enough. We privilege, if you like, contemporary scientific ways of understanding the world. But I wonder if you'd like to say a little more about that, including in the climate change context, traditional foods, for example.
Yeah, absolutely. We recognise often people are very happy to do an acknowledgement of country or have a welcome to country and seem to see it as something that one does without really understanding what that truly means. And part of what I understand of it is that when you do a welcome to country, or when you have a welcome to country performed that you're eligible to participate in, you get a transfer of information, of knowledge, and that knowledge has come down for a long, long time, like what to eat, when to eat it, what is safe, how to purify the water, where not to go and where not what to do. And a lot of it is around the preservation of what is. And when I speak to elders now, they get quite sad at the sorts of mining that is happening, because much of that mining is using natural resources that are irreplaceable. So if we think of things, for example, like on the Narrabri Plains and the brand new CSG gas mining hubs, thousands of them that will scatter across New South Wales, it's not so much the drilling down to this like pocket of gas that is lurking there. There's a significant amount of work that needs to happen in utilisation of precious natural resources that are irreplaceable, with damage that will continue on. So the story that the elders will tell in the future when they do a welcome to country will be of one time we were able to go to that place and access beautiful fresh drinking water. But now we won't be able to, and we can only come out here now on a bus because we can't live here, because the landscape's been degraded over the last 20 or 30 years. And this is a persistent worry that I have when we walk into country and I look across a landscape with elders, and I know that that landscape's changing before our eyes, not only because of droughts and the catastrophes that have been happening in the last 20, 30, 40, 50 years, but because of the lack of ability to be able to see what mining does, or the lack of ability to see what the extraction of resources does, and the sale of these precious things from our grandmothers' hearts. And this is all of you. You all call Australia home. You all belong here now. These are the sort of obligations, rights and responsibilities I was talking about with Auntie Matilda House at the start of my 3 minutes. That we all have to stop and take a breath and recognise that it's one thing to deal with the catastrophe that's coming and the damage that's been done, but it's also that preventative medicine stroke that we need to all make in our world now to stop this from continuing on. And I don't know how to turn the ears on for our local governments, our state governments and our Commonwealth governments, because they're just seeing the money appear before their eyes, and we've just got to stop them from doing it.
Great, thanks very much for that, Lisa. And I might also at this point just draw Paul Beggs back into the conversation too. Paul, I saw a question from Anne Royko about the Lancet Countdown and the indicators we track and opportunities for folks to engage with that process. I know that each year you think about new indicators, but I might just throw over to you to enlarge on that broader point a bit.
Thanks, Tony. Yeah, the team that we work with does evolve over time. And I think that's important to have a dynamic team. And we're constantly trying to keep up with the global Lancet Countdown in terms of the focus, but also making the report relevant to Australia. So we're very happy to talk to anyone in Australia about new indicators and new team members. So please get in touch. But I also wanted to link back to the discussion about drought, which reminds me that in some ways, like general society, I suppose, much of the time we tend to focus on physical effects of climate change on health, but equally important, perhaps more important, is the impacts of climate change on mental health. And this is an area that we have looked at in the past. We didn't report on it this year, but hopefully we'll get back to reporting on mental health and climate change in future reports. And we were actually the first country to produce an indicator looking at mental health and climate change, looking at one extreme end of that in terms of heat and suicide. So we hope to report on that indicator again and to actually develop it. So hopefully we can sort of find the time and resources to really focus on that area in the future. Thanks, Tony.
Great. Yeah, thanks very much, Paul. And your final mention there of resources at the moment, of course, all of this work being done pro bono by the contributors to the process. And we're very much hoping to attract some funding for the work in the time ahead. Really important about mental health in this context, Paul. Later today, I'll be catching up with Grant Blaschke from Beyond Blue. You know, he's very concerned about these issues, as are people like Ian Hickey and others. I think many of our mental health leaders are really very concerned about the mental health consequences of climate change, bushfires, prolonged drought, as you say. Celia, I can see your hand up.
Yeah, I just wanted to quickly add that, of course, we all know mental health is severely impacted by climate risk, but it's quite tricky to measure. And we put that indicator in the global report this year using a quite intriguing strategy, which was to look at global tweets. And on very hot days, they found that there were more people tweeting about being in a bad mood or a sad mood or depressed than on cooler days. And that was actually measurably demonstrated in global tweets.
A really, really interesting example, Celia. Thank you very much. Now, I am going to come to Michelle Escobar's question. I think it's at this stage, it's got the most likes there in the Q&A box. And I had delayed this a little bit, Ollie, because I seem to be coming back to the heat and health stuff quite a bit, but it is a priority for us here in Australia, and it's prominent in this year's policy brief as well. But I just wonder if you'd like to say a bit more about the measuring tool that you've been developing initially in the context of tennis, but potentially with wider application. But over to you.
Thanks, Tony, and thanks, Michelle, for your question. So this tool that we've developed for Sports Medicine Australia is specifically for sporting activities. And the way it's done is that it enables us to, or enables the user to develop a somewhat individualized risk profile for a given sport within a certain extent. Now, can we apply that directly to other activities during everyday life? We can use the same principles, but we would need to develop would need to develop it in a way in which the underlying algorithm that we're using is catered towards people who are more at risk of the negative health effects of extreme heat among the general population. So this would be people who are elderly and they have age-related decrements in the ability to sweat, people with cardiovascular disease. So the same principles could be used, but we couldn't use the same tool. We'd have to develop a new tool, but that's eminently possible. And all we really need is the buy-in from major stakeholders to enable us to first develop that tool for that purpose, and then being able to disseminate that tool to ensure that it reaches the people who need it the most. But it's a relatively straightforward thing that we can do. But just to answer your question in a direct way, we can't use the sports-related tool for non-sporting related activities, because it's based, the algorithm that's in the background that generates that risk stratification is based on the premise of elevated rates of metabolic heat production that arise from physical activity. But again, the same principles could be used and then applied to more vulnerable populations. And we'll be very excited about the potential opportunities to do that alongside some of our health partners.
Great. Thanks very much, Ollie. And maybe just one final question to respond to Simon Turok's question relating to COVID-19. And I think perhaps if I begin, and anybody else who might like to add anything in, it's absolutely true, Simon, that Australian governments, state, territory and national have come together in responding in an evidence-based way to the pandemic and pandemic control measures. Arguably, we've actually been world leaders in this area, although there have definitely been some problems with the vaccine rollout. But what we need is the same kind of evidence-based response to health impacts of climate change. We haven't seen that yet, and we absolutely must see it if we are to safeguard health now and, as Lisa said, for generations ahead. Indigenous people think multiple generations ahead. It's a responsibility for all of us as Australians to be doing that. I just wonder if anybody else from our speakers would like to add to that. Harriet, yes, why don't we give you the final word from the COP?
Thanks. I mean, it's not necessarily directly COP related. I was going to say, you know, there's been a lot of research around how biodiversity loss and climate change is going to make us more vulnerable to zoonotic diseases like COVID-19, obviously having come from an animal. I think there is, to an extent, we can use the health interest in climate change in COVID-19 to try and get people interested in the link between health and climate. But I think climate disasters, particularly in the impact of climate and health, they tell a good enough story on their own. And I think that came up enough during the bushfires of 2019, 2020. Obviously, the amount of smoke that was blanketing our major cities made people really concerned about the impact of their health. And then in terms of getting this to convince stakeholders like governments or businesses even to commit to significant action on climate change, really the way that we need to think about it, you know, the normative argument of you should act on climate change because it's the right thing to do works with some stakeholders, but not with all, as we know. And I think the way that it needs to be put forward is cost, really. And you can frame it as the costs to the health system from not acting on climate change are going to be pretty enormous, you know, initially in the short term from more cyclones causing damage to infrastructure, for example, or bushfires or, you know, flooding. But in the long term, obviously, then we also know that the risks that have been outlined today to, you know, cardiovascular health and, you know, heat deaths and so on is going to have such a massive impact in the long term. But I think where we fail to make this argument really compelling, and I think it's an issue with climate change, you know, trying to get action on climate change more broadly, is that the impacts are so far ahead, a lot of them, and it's so hard to draw that link between the, you know, our action on climate change now and how many lives we're going to save in 30, 40, 50 years time. So it's very challenging.
Thanks very much, Harriet. And as you say, costs for the healthcare system. Importantly, though, also costs for society. The health costs are not just borne by the hospitals and the healthcare centres. Health costs are borne by society as a whole. Ying, I think you've got your hand up. Perhaps a final word from you.
Just a quick add-on to the engagement issue. Our data actually show that the engagement, media engagement with health and climate change topics sustained regardless the large coverage on COVID responses, which reflects the great efforts that we've been all doing over the last couple of years. And we shall continue that efforts and think about the more long-term futures for Australia, regardless what health emergencies, what related to environment and another natural disasters, we need to better prepare and respond to that as a whole nation. And thank you.
Thanks very much, Ying. So maybe I'll just make a brief closing remark. So I think for me, the takeaway from the health lens on climate change is that it helps us for three reasons. It helps us understand that climate change is urgent, that it's a personal challenge, and that there are positive stories to tell. So let's take those in turn. Urgency. Climate change is not a future abstract environment over there issue. It's already happening and it's affecting our health. That picture of Finn that I started with helps us understand that. That picture also helps us understand that there are individuals, there are people being affected. It's not just about research, data, charts, scary scientific information. There are real human stories, like the story of Finn and his mother in that tinny escaping the fires at Malakuta. And finally, there's positive stories to tell. The transitions we need to make to sustainable ways of living in Australia will enable us to be healthier. Not just because climate change won't be as severe as it might be, but also because we'll be eating healthier food, a plant-rich diet. We'll be walking and cycling more, getting more incidental physical activity. Air pollution levels will be lower. The list goes on. So a health lens on climate change helps us understand that climate change is urgent, personal, and positive. So action on climate change is the positive bit. So let's thank all of our speakers and panelists for today's launch. Thank you very much. And thanks to all of you for participating. Terrific questions there. And look forward to continuing to engage with you on these really important issues. So thanks to everybody.